Mr. Chairman. Mr. Secretary, I represent a very big aerospace cluster. About 150,000 people are involved in aerospace, both working for Boeing as a manufacturer, but also the supply chain. So we worked very hard on getting the CARES Act to support activity that would get capital into those areas, and also to try to focus on what we could do to protect essential workers. I'm sending you a letter today asking for trade adjustment assistance for workers who are impacted at Boeing, and so I hope that you will look favorably on that petition. I don't know if you want to make any comments about that, but one of the issues that I think we really have to think hard about is that we want to maintain our competitiveness in aerospace. These are highly paid jobs. And when people get laid off, because obviously we've been impacted by this and the whole transportation sector has been impacted, then those people who get laid off may have a package that keeps them connected to the company for a while. I was a big advocate of saying that critical defense workers should have extra healthcare benefit activity so that when this crisis is over, they'd be more likely to come back into the fold, and that we wouldn't lose these critical defense workers. As it is, we ran into a big roadblock. So much of the discussion this afternoon has been around the $600 and extending that. My question is really more on healthcare. What are we going to do to keep critical workers in the sector that we would like to keep them in, is after their 1 month of COBRA benefits runs out, and we're now talking about aerospace engineers, that they are then on the hook for paying for their health care themselves. They can continue that COBRA benefit, but if they pay for it themselves, which again is a big out-of-pocket expense. So my worry is what's going to happen to those aerospace workers is they're going to find another job that has health care, because they're not going to wait a year from now for the aerospace market to pick back up. So what do we need to do? If you want to comment on the TAA or the benefits of trying to provide assistance to aerospace manufacturing from trade adjustment, but also what is your plan? What do you think the plan should be for keeping critical workers connected by having some sort of health care benefit that's out there and available in an affordable way?
I'll certainly look carefully at the TAA letter. I recognize that the Trade Adjustment Assistance Act is an important form of relief to industries, companies that have been affected, and we'll certainly take a look at that.
And I'm saying they were affected before this, obviously. The whole
Yes.
sector was affected because of trade issues.
Yes, and by the way, I certainly share your view that it's a very important sector for this country for a number of different reasons. With respect to healthcare, providing it is always important and often a challenge. We extended the time that people would have to elect COBRA benefits during the pandemic, so people had more time to evaluate that option, and in the rush of everything else going on, didn't lose out on those benefits as a result of the sort of ordinary deadlines that apply. I'll have to give further thought to mechanisms that might be used to induce people back to aerospace jobs, perhaps through a healthcare benefit, rather than having them go elsewhere that might be of less importance to national security or the like. And it's not an issue that I've looked at, but I'd certainly be interested in talking to you about that aspect of this problem.
Well, it's one of the highest paid manufacturing jobs that we still have in the United States.
Yep.
And I think the second 100 years of aerospace could be a very big opportunity as the rest of the world continues to grow economically in the future and gets into aerospace. So I would hope that we would figure out how to upskill these workers and also figure out this healthcare benefit, because if they don't have healthcare, they're not going to stick around waiting for us, even if they're on TAA. We got to figure out how to get the healthcare benefit to these workers and get them back into aerospace and maintain U.S. competitiveness. Thank you, Mr. Chairman.